The Infertility Center was established in 1992 as a reproductive healthcare center, which later specialized as an infertility and hormone research center. It has provided service to more than 5,000 couples, of which about 1,500 have been blessed with children. Since August 2002, this center has started to provide in vitro fertilization treatment to those couples who otherwise would not conceive. We give emphasis to counseling our patients in gathering their preliminary history and their probable cause of infertility. We also brief them on the line of treatment and its physical, psychological, and financial implications. It is very important to carry out the proper investigations before starting the IVF procedure. The major investigations we look into are hormonal assays, pelvic ultrasonography, semen analysis, tubal patency tests, and of course, the general well-being of the patient. The hormonal assay is a crucial step in the diagnosis of anovulation in females and oligozoospermia in males. It also helps to monitor the stimulated patient during the IVF procedure. Pelvic ultrasonography is a very important step in the IVF procedure. Patients who are stimulated with ovulation-stimulating drugs are monitored serially by transvaginal ultrasonography. This is done to observe the development of the follicles. When more than 2 follicles reach around 18 millimeters, human chorionic gonadotrophin is injected to trigger ovulation. It is also important to note the endometrial thickness for the easy implantation of the embryo by transvaginal sonography. 34 to 36 hours after HCG injection, we prepare the patient for follicle aspiration or ovum pickup. For ovum pickup, the patient is taken to the OT, and the procedure is carried out under general anesthesia. Sterility and aseptic precautions are strictly observed. Most of the items we use are disposable. This is our ovum retrieval theater, and here we see the surgeons preparing for retrieval. Under transvaginal ultrasound guidance, the follicles are picked and punctured in series, and the follicular aspirate is collected in the test tube. follicular contents are transferred to the embryological lab. At the same time, semen is processed and incubated at 37 degrees centigrade in 5% carbon dioxide. Now the oocytes are identified in the follicular content through stereomicroscope under the horizontal laminar flow hood. These oocytes are cleaned in flushing media and incubated separately for 4 to 5 hours. After 4 to 5 hours, culture droplets are made in the culture dish, and the eggs and the sperm content earlier prepared is added to these droplets and left in the incubator for fertilization. After 20 to 24 hours, the eggs are observed under stereomicroscope and the oocyte sperm complex is denuded. The fertilized eggs are identified. The presence of 2 pronuclei and 2 polar bodies indicate normal fertilization. After cell division starts, we take the embryos at the 2 to 6 cell stage. For transfer, an embryo transfer catheter is used. Normal-looking 2 to 6 celled embryos are collected carefully in the ET catheter in the flushing media and transferred into the uterine cavity under USG guidance. The patient is kept for 6 hours on bed rest. She is then discharged with daily progesterone injections. She is tested after 14 days for pregnancy. If the pregnancy is confirmed, she is advised to have relative bed rest for 3 months and follow up in special antenatal care.